Okay, we are recording. So thank you everyone for joining. And I just wanted to introduce the panelists that we have tonight to help us talk about how to advocate for health equity. And we have Kay Matthews, who is from Houston. She is the founder of the Shades of Blue Project, and she'll be talking about some of the work that she does. I'll let her introduce herself a little bit more about that. And then we also have Brianna Henderson, who is from Dallas. She is the founder of Let's Talk PPCM. And we have Tomkea Issac, who is in North Carolina, and she is the founder of an organization called Jace's Journey. We also have Kim Smith, who is also in, no, she's in South Carolina, I'm sorry. And she is president of the board for the Preeclampsia Foundation right now. So thank you all for joining in your time to be able to answer some of the things that kind of came up at Summit last year and be able to have this discussion on how we can advocate and how we can do this in a great manner. So some of the questions that came up last year at Summit, one of them was, what can we advocate for? And I know I let all of you kind of know these questions up front. I just want to go through like one by one and ask you, like, what are some of the things that need to be advocated for to help close that gap in the health equity and bring that gap closer together? Kay, how about you go first? Unmute you. Okay. Unmute. There you go.
All right. So when it comes to what exactly you should advocate for, I think the best way to go about that is if one, whatever your birth story is, or let's say you're advocating for someone else's birth story. So you want to start there. So let's, in this case for me, I do maternal mental health, but with also an add-on to bringing awareness to those who have experienced infant loss. So that's my niche. So that's what I advocate for. So the best way to advocate is to, one, have some type of connection to the work itself. Not to say that, again, it doesn't have to be your experience, because there are advocates who are maybe advocating for a sister or aunt or someone in their family, but it still has a tie to the work. So it's best to advocate for something that you know about or something that you're willing to learn more about. Because of course I came into this work with a full focus on maternal mental health. And of course, over time, that has grown to maternal and mental health because it's one and they go together. So it's not one or the other. So that's my advice on that.
Okay. Excellent. Brianna? I'm going to unmute you.
Okay, hi. Well, yeah, I agree with Miss Kay on everything she said with the connections and everything, because I don't think I probably would have been experienced or more experienced about with the condition that I'm dealing with if it had not been for me going through it myself. So I'm very strongly with the self-advocate and self-awareness of being able to learn your body and know we're our best advocates. And so with that, with me going through what I actually had to experience on losing my sister with the condition, and then for us to not know what it was when she lost her life behind it, and then all of a sudden 3 years later I get the same condition and now we have a name for it, and it turns out it wasn't hereditary, so it was just something random that happened, and they said it's a genetic disorder, but it's also something that randomly happened in pregnancy, and it wasn't enough awareness out for it. So how my awareness life got started, I actually went to cardiac rehab. Cardiac rehab, you have to go there to basically bring the strength of the heart muscle back to be reversed. And so the nurses had noticed the picture on my shirt with my sister, who had already passed away, and they was just interested that, to know that she had the same illness, and they felt like, oh, okay, well, this should be brought awareness about. And I was like, oh, okay, I was dying at the time, so I wasn't really into the focus of awareness until they explained it to me and how I agreed with everything. And so that's kind of how my road got started with me.
Thank you. All right, Tomkea, you're off of mute, so I will ask you, what are some things that we can advocate for? What are the calls to action?
My call to action is education. I felt like, again, I agree with Kay and Brianna with the experience. Like I came into this based off my experience with, infant loss and maternal morbidity. So it's kind of like, that's my passion. And since I've met like most of you or all of you, it's kind of opened my eyes to, like Kay said, more and more things. But I think you also need to base it off what's going on in your community. So I don't know a lot of people suffering from maternal mental health, and that's not because it's not happening. It's just because that's not something that's in my area right now. So I wouldn't go try to advocate for that because I don't have those connections to the people who are actually going through it. But I can advocate for women who are experiencing, implicit bias during healthcare. And a lot of my focus right now is to like build a community with doulas that can assist, and kind of like me being the intermediary for like the ones that are doing it on a volunteer level. Like we have a lot of people, doulas in North Carolina, that are doing it as volunteers, and that's not fair because you're taking your time out from your family to try to help somebody have a successful pregnancy, and you're not getting paid for it. I commend them, but there has to be some type of compensation for the time that they're spending, and we still need them, right? So we still need them to do their jobs, but also to get paid for it. So my advocacy is for implementing that, and I think we have a bill that's trying to get passed right now for having, a doula service or even midwifery as a billable service, because that's what we need. But in the meantime, that's what I'm advocating for. So I think you really just need to base it off your area and what do you feel like the biggest need is.
Okay.
And my battery's going down on my laptop, so I gotta move.
All right, well, good. We will switch over to Kim.
Hello, you can hear me okay?
Yes.
Perfect. First, I must say it's such an awesome moment that I'm having just listening to the other panelists share their responses to this question, and I completely agree with each of you. I do believe that for advocacy in this line of work or this particular area, it really must start with your own personal story. And what you'll notice is as you start to delve into seeing where the gaps are and where there's space for you, that'll probably help to guide your journey. And I do believe, for me, advocacy has been a journey. So 8 years ago this March, my husband and I lost our first daughter due to HELLP syndrome. So Brianna, I'm with you. I was literally fighting for my life. Every day I wake up is a blessing because I was a near miss. So I don't take that for granted. And I knew that we wanted to do something. I just wasn't sure what. I knew that I felt uneducated on preeclampsia and HELLP syndrome. I knew that, the data as it relates to disparities, I had questions surrounding that. I had questions surrounding how well could my providers have communicated with me. I had questions about just, now that I live in South Carolina, although I am from North Carolina, so let's make that clear. I am from North Carolina. What does that mean for my children? Because I'm raising children here. So I had a lot of questions. And I started the journey first connecting with the Preeclampsia Foundation in the hospital room on the Wednesday after I delivered, because I had said, what is this? What's happening to me? So before I was even discharged, I began to read the stories of all of these survivors, and I felt immediately connected. So my initial advocacy is just, I've got to tell people what this is. because I work in healthcare and I didn't know what this was. So that was my first stage. And then as I delved into the work of advocacy from this level, I decided that I had a desire, I never really spoke it, but I had a desire to impact more of on a broader scale policies and specifically now getting the patient voice to the table. I realized that there wasn't a clear path for me. There wasn't space for me at certain tables like the well, in South Carolina it's called the Birth Outcomes Initiative, but of course this is basically our, the PRCs or PQCs, excuse me, and the maternal mortality review committees. There wasn't really space carved out. They didn't really know what to do with an individual that wasn't backed up by an organization. When they said, hey, I want to help. They said, okay, that's good, but who are you representing? And I said, myself and my family. And they kind of passed me some general information that had nothing to do with preeclampsia, and that was that. So I realized we need to create space where the patient advocate has a clear seat at the table and their voice is recognized and respected as a partner in the solutions. So that's really where I am now, and that's, I believe, why I've led to serving on the board for the foundation. And so be open to the journey. Start with your personal story, see where the gaps are, and then you can make space for yourself.
Kim, what part of South Carolina are you in? I'm sorry. Can y'all hear me?
I'm in Columbia, technically Irmo, but basic, that's the Midlands area. But my family's in Raleigh and Greensboro.
Okay, remind me to connect with you after we get off this call because you're not too far from me. So
Right.
So, and our stories are very similar. So I would love to talk after this though, sorry.
Oh, no.
That's okay.
Sure, absolutely.
I'm sorry you guys haven't met each other before, but I will make sure to connect you two.
Thank you, sorry.
Excellent. So those are some great things, and talking about like health equity and birth equity, and a lot right now, is in the news, and we're constantly seeing the stats about like how great the disparity is. What can we do besides just talking about, like, I feel like there's a lot of, we need to talk about it, we need to talk about it, but there always gets to the point of like past like the talking about it. What can we do about it? So like, how can we advocate for change to close that gap and to address the health disparities? Tamika, you look like you have something to say, okay?
I honestly believe that it has to be local. You know what I mean? Like it has to be community involvement in order for you to actually make a difference right now. And I'm all about doing something, like you said, right now. Let's stop talking about this. Let's do something right now. What's going to be able to educate us right now? What's going to help us have successful pregnancies right now? And, from research and just talking to people, it's community. It's having a support system. It's knowing what's happening as far as the disparities go and educating women and families about how to protect themselves or what to do in these situations where you didn't think you had to do anything at all. You know what I mean? Like, in my case, I didn't feel like, I needed to know as much as my doctors did to have a successful pregnancy. But you do. It's crazy that you do, but you do. So I think the education piece is key. And then trying to implement, and like I said, with me, I'm trying to, as a community, I'm trying to get more community involvement with like doulas. So I'm doing scholarships for like doula training in the Charlotte area for people who want help do this work. And my goal is to actually try to fund doulas for people who can't afford them, because the ones who can't afford them are the ones that need them the most. So I think just making those steps focused on what you can do in your neighborhood or around the corner is like really key, because, you know, making a global impact takes time. Making a community impact takes less time. So, yeah, that.
So my advice is just about simply showing up. You know, you kind of I didn't make a list, but I knew exactly who I wanted to target. And once I targeted those, then there came another group of people I should be targeted and talking to. But you just got to keep showing up. And then too, it's always about your plan. What part do you want to play in this work? So for me, like listening to Tamika say, community, right? So it's all about the community for me. But my mindset is worldwide community, like the world, you know. It all takes a lot of time. It all takes a lot of effort. It's really about building like true connections and keeping those connections going. You know, it's one thing to get a card for somebody and throw it in your purse and never come back to it. You know, make it a habit. So I personally have a habit of making 2 connections a day. My goal is always 2 connections a day. So I continue to build my own resource data bank that I can fall on. And then also at the same time, building a resource bank that I can give others so they can utilize it too. So for me, the biggest thing is continuing to show up, finding your niche, and working at that before you start to take on other things. Now, of course, I didn't initially, well, I take that back. I did initially want to take on the world. So I'll be honest, I did. I want to take on the world, but I knew I couldn't do it like right out the back. So I worked myself up to take it on the world with one. I started with one country. So I'm just working the list, but it's all about your goals and what you set out and what part of this work you want to conquer. That's how you do that. But the big part of that is continuing to show up, usually in places where people don't expect it. But if you start building those relationships, you'll always be somewhere where people don't expect you to be. That's the goal.
Oh, can I talk? Oh, yeah,
No,
I
go
agree.
ahead, Brianna.
I agree with both of y'all. With Kay on the connections, and I think that's very important. With me, in my experience, a lot of people don't know what PPCM is, so we kind of get pushed out the door on conversations and stuff. You know, majority because a lot of people hear that it's rare. So in my case, I felt to be listened to or for people to pay attention, I had to go to the media. And with going to the media instead of trying to before I was able to speak, you know, or to be come to conferences and stuff, I had started the Let's Talk PPCM blog before it became an organization, and I was just trying to find ways on with working with the media on how, since a lot of people is on the media, you have, you know, hospitals that's on the media now. So I mean, like everybody is on the media. So I thought, okay, well, what if I created this page and I just started jotting down stories, and so people can see that, okay, it's not as rare as they're making it, or it's not as rare as they're saying it out to be. With the numbers are increasing with the rate of, you know, this maternal thing for the PPCM. Each time a woman is pregnant and get diagnosed with heart disease or something. So we automatically have an urge to think that, okay, maybe it has a link to PPCM, which is now we're finding out that preeclampsia can be higher risk to be able to develop PPCM if you continue to have kids. And it's like when my sister was diagnosed, we didn't know what it was that she was going through. Neither did the hospital know what she was going through, because there was no information out that we knew to be able to read or to be able to research. Other than that, she had a heart condition that they didn't know where it came from. They said it was a viral condition. So of course that's going to be ruled as natural cause in a younger woman. She was 27, but we didn't have no prior heart conditions before that. So when I got it, I was like, okay, well, why? I saw this little information out there for it, you know, just a very little information. So I wanted to create my own information to be able to do the research, and which is now, you know, trying to be with the researchers and the scientists now, to just try to figure out a little bit more about the condition to be able to put out more, but through the media as well, because with the media, you able to, you know, kind of post or broadcast or be able to reach people in different states, countries, you know, and I think that's very important as well. I'm trying to start in the media and being able to try to advocate your way, because that's actually how I kind of got people to contact me, was through the media and how I was doing things. So I think that's a major part as well, being an advocate in the media.
Okay.
This
Excellent. Thank
just
you.
so on point. Oh, hello.
Yeah, go ahead, Kim.
Definitely so on point in terms of how to get people's attention and really create the noise around it. One thing that is something that echoes what has already been shared is the fact that yes, it's work, but don't underestimate the wave that's happening now around health disparities. And when I say wave, so when we lost our daughter 8 years ago, the ProPublica articles hadn't come out. You know, there's so much that hadn't happened yet 8 years ago compared to today. And we're still riding the wave of a lot of work that have been done, interviewing patients with other patients and families, really pushing and making it all the way to presenting before Congress on their story. So there's a lot of focus on this right now. There's actually a lot of talk about it, but here's what I'm observing. People just don't know what to do. They don't know how to tackle disparities. It's not a low-hanging fruit. It's not easy to fix. It's very, very complex because there are many layers, and not just layers, but there are many dimensions of this work. If there's a focus on doulas, which I think is brilliant. One of my good friends is a doula. She's actually a maternal health advocate in LSW in Georgia, and her focus is maternal mental health, and really also supporting doula programs. There's the need for other hypertensive disorders of pregnancy advocates, not just preeclampsia and HELLP syndrome. So there's so much opportunity right now. So I want to encourage you by saying there's a lot of talk about this. I mean, I was just sitting in our birth outcomes meeting for the state of South Carolina, and then the vision team meeting for the state, and there's lots of discussion on racial disparities right now, and which really help equity, but specific to this this focus area, and they're still trying to figure out, how do we even approach this? Where do we start? What makes sense? And what I would say to you is become very informed. There is nothing like a well-informed patient advocate. So know the data, know what your state is doing, to Tamika's point, know what's going on in your area that you're interested in, and then take up space in the room. Because I'm telling you, I truly believe now that people are looking for advocates. As a matter of fact, I sent Nicole an email, was that last week, saying, okay, our state is ready now. They're ready for someone to have the table on this maternal mortality review committee. And it needs to be someone other than me. There are many people in South Carolina other than me that's been impacted by this. Take up space. They're asking for you. They don't know how to find you. So be informed, be willing to take up space and have a seat at the table, and be bold enough, and this is going to come through you all's trainings, and you all have already been doing this, be bold enough to ask questions that make even providers say, you know, I think I agree with that. I wish I could just record some of our conversations we have in these meetings, where we really, you know, I remember, so last week, good example, last week, they were discussing some of the bundles that were, that they rolled out in South Carolina, and just reviewing them and how we can, you know, improve what we've already done. And one of the bundles, and this actually was it wasn't the hypertensive bundle. I believe the bundle we were talking about was related to, goodness, I just went blank, but it was related to, I will remember in a moment. Excuse my mommy moment.
It's like hemorrhage?
Hemorrhage. See, we are connected, Nicole. So it was the hemorrhage bundle. And I had a question in terms of, I always ask this because I work in healthcare. I work on the hospital side, managing departments. I work on the physician practice side now. So the discussion of the continuum of care is very, very common, and one that we don't always get right. And when we have these kind of programs, it always makes me nervous when the entire focus is on the hospital, as if the mom just disappears when they're discharged. So it makes me nervous when there's not a connection. So I'm always going to ask that question. That's like my one question I always ask whenever I'm in the room, to just challenge people to think. And one of the nurses said, well, we do this education. I said, okay, so what about the people that didn't hemorrhage but are high risk, are at risk for hemorrhage postpartum? How are they educated on signs and symptoms where they're not terrified, yet they know when to call back to the hospital or to the provider? And they referenced this booklet, this huge packet that was probably several pages, and hemorrhage was somewhere in that packet. And I was thinking, and this is not a dig against this, and this is a medically reviewed document that they provide on discharge that is a wonderful standard to do. And, you know, I couldn't help but kind of giggle inside thinking, who on earth is going to memorize this packet and know and understand everything in it when they're just trying to get out of the hospital after a baby? How well do you script those kind of conversations specifically for someone that's at risk for hemorrhage? Or do they not know? Or should they assume they're at risk for hemorrhage, even if you don't tell them? I had so many questions that were holes that I know patients experience. The same thing for HELLP syndrome patients. What is the likelihood of getting back to the ED after HELLP syndrome because of elevated blood pressure? I was one of those patients. How well do your ED doctors, how well are they prepared to see those HELLP syndrome patients and realize, oh, this is not a typical high blood pressure. This is this is serious. We need to get them back and not just have them sitting in the ED waiting room forever because they think it's just a typical heightened blood pressure that can probably level out. And what's the education around that? So I'm always bringing up questions around education that pushes them beyond just, producing another brochure, but really thinking about the communication. That's actually in the follow-up meeting, one of our DHEC directors stated the same thing. She said, providers, be willing to still have the conversation. And that's basically what I was saying. Go beyond the pamphlet and have the conversation. So, but my point is, my point in saying all of this, just as an example, is that when you get in the room and you push for conversations that can better support patients that may not be either mentally ready or confident to advocate for themselves, right? Which is a health disparities issue in itself. Be willing to ask the questions, not in a way that's overly dramatic. I may sound more dramatic now than I did last week, but in a way that shows you are an equal partner here. And you have insight and you have examples, you have stories to share. And it starts there. And that might seem very simple, but it starts with every individual moment where you have a provider's attention, where you have the attention of an influencer that can remember your story and your recommendations, and know that you're not just an emotional patient in here that needs everyone to fix what they did wrong, but you are well informed. And it starts there. You can start there and you can reach the globe. You really can. But you have to start being well informed with understanding where the gaps are from your experiences and the stories of those that you bring with you. And I promise you, they will listen. They're looking for you now. I hope that helped.
Thank you. Thank you. So one of the questions that came up from Summit was, we had this, for those of you that weren't there, we had a panel on like different perspectives and understanding where other people are coming from, because we do sometimes we get stuck in our little niche and this is what we know. But like to be a representative voice and to be like a advocate for maternal health in this space, like I feel like we needed a little bit of understanding of some other perspectives. Like, you know, it's preeclampsia people. I know like Tomkea and Kim, you'll understand this, but like when we think like, why would you be fighting against C-sections? Like to me, I'm like, I needed a OR, a like surgery team, I needed a blood bank, I needed all the things. Like that's not something I would advocate to like reduce C-sections, but to understand like why that was important, because there's other risk factors and things that are going on and what that causes later on. So like that was one of the perspectives that we had. And then wanted to like talk about like the mental health part of it too. And Kay did a fantastic job talking about that. But it was like one of the questions that came up in our Slido questions were like, well, how can I as a white woman advocate for this? So what can we do to like lock arms and partner and support like these efforts that we can do it in a way that like it's not maybe misunderstood, or it's not like disrespectful, or we're not overstepping? Like what can we do to help? And Kay just went on, her camera is on mute, or her camera is blocked out. Who wants to answer first?
No, I'm here.
Okay.
Sorry.
That's okay.
So that question can deem to sometimes be kind of tricky. That's
why I was like, we need to talk this out. This is one of those, I know all of you ladies, and I appreciate all the openness. We've had some great conversations, but I'm like, this is a tricky topic.
One, for the very first thing I would like to say around that is there are boundaries. One thing to always keep in mind when you are fighting for Black women, think about how those Black women feel when they don't have an opportunity to turn off. So we are Black, right? So we have these issues, so on and so on, right? But if you're fighting for us, you get the opportunity to elect not to or to. We don't. I mean, that is really, it's like that. So there are some boundaries that sometimes are crossed. In other words, you can't fight harder for me than I am allowed to fight for myself. It's like you take, you know, sometimes it can feel like the takeover. It's like, wait, I can speak for myself. You know, we do want allies, and allies are just like friends. You know, you have a friend, she know you, she know everything about you, but your friend also allows you to, yes, your friend will step in and fight for you, right? But your friend should also know when you need to fight for yourself. So when we think about allies, we have to look at it from a lens of being a friend. Like a friend knows when, oh, okay, I need to step to the side. Or, oh, no, this is actually my opportunity to step to the front. You just can't. One thing I suggest is, one, not trying to fight all the battles that we have either. Again, finding where it is, finding you someone to work with, and building relationships there, and not trying to take on all the battles. We have too many. It just doesn't make sense for you to do that. Again, and then it goes back to relationship building as well. When you have a relationship with someone, I mean, you can even just for the sake of this call, we can just talk about me and Nicole. We have a working relationship. We have a friendship. When there are things about this work that I do that she don't understand, she's willing to ask me, and vice versa. You know what I'm saying? Because we are in this work together. So it is about building a relationship and knowing when and when not to, because all battles are not to be fought by. Like, again, we can fight our own battles. Sometimes we just need a little assistance, but it should be a partnership. It shouldn't be every time someone says something about another Black person, you feel the need to fend for me. No, it doesn't. It shouldn't work like that. But there are so many other different ways things can. It's about boundaries for me. again, you can't fight harder for me than I'm allowed to fight for myself.
Okay, thank you. Tamika, I see you over there nodding your head.
So
There you go.
I think like in some situations that people feel like, and I think this is kind of hitting on what Kay said, they need to be the savior, right? And I think as long as it comes from a place of sincerity, like you're really trying to make a difference in how this is going, or how that you want to make a change because you care about the people that it's affecting, versus, oh, I'm here to save all the Black women. You know what I mean? Like we don't need that. We need somebody to be beside us to say, yeah, this is exactly what's going on and we need to make a difference, versus you trying to take over the advocacy of the situation. Does that make sense? So I think I just think it needs to come from a place of sincerity and a place of, empathy and really wanting to make a difference versus trying to be a savior.
Okay.
Yeah, this is Kim. I have a lot of thoughts about that. Here's what I'll say. The greatest thing you can do in this work right now is, to me, one of the greatest things you can do is extend the invitation to the table. I'll say that again. One of the best things you can do in this work is extend the invitation to the table. And if you don't have someone to extend an invitation to, then I would question that entirely as well. You really should have someone to invite in to your table of influence with this work, if this is a huge part of your passion. And if you don't yet, work to connect with women of color who have that story and see where your advocacy passions align and invite them to the table of influence. Because here's the thing, sharing the story, being a voice, is wonderful, but there's nothing like the power of a personal story that moves the needle even more significantly. So you notice in the news, the articles, the huge ProPublica campaign that came out, linked to that the Preeclampsia Foundation helped support, as well as even there's some circulation of a lawsuit that's going on with a family who lost the wife, and I won't even go into the details of that. The consistent thing is that the story of that woman of color is being shared through their lens and their voice, or the voice of their family. Because what would you do if your story was altered or interpreted from someone else's lens, and it changed the context of the story? So here's what I recommend. I recommend that you look for opportunities to partner, connect with women of color that have a story. There is no reason to not extend an invitation. And when you do, there's more power in numbers, and there's more power when people are united around a common cause, and you have more of an understanding and an appreciation of the disparities surrounding their birth outcome. It's interesting because even now, there are individuals, there are people who question systematic racism as it relates to health disparities. And I'll just say that there are people that are not convinced, as if I have to convince you that that was someone's experience, and it's ridiculous. So to me, I don't need someone that questions part of my story to be my voice. I need you to extend the invitation so that I can use my own voice, because we're all, obviously, we all have a voice and a story to share, and there's power in the unity of stories. That's how you move the needle. And if you don't have the right people at the table, it's going to be very challenging to come to the solutions that actually help solve the problem. And I think that's a part of our problem. We're now getting to the point where we're saying, oh, we need the patient advocates, and we need them in these rooms of influence with the providers and with the policymakers and with the payers. And we need to understand these stories even more. You can't be the mouthpiece all the time. I hope that's okay to say. I'm being very direct. Let me know if I'm
No, that's
not,
good. Thank you, Kim.
No, you're not. That's what we want to hear.
But I think that's important, very, very important to share. And when you have, so for me, and this applies even as an African-American woman who has my own experience, I don't have the experience of everyone that I connect with, right? However, I'm a story collector. One of my sons, I have 3 sons now, 3 miracle babies, and my oldest is 6, and one of his favorite books is The Word Collector. I'm not sure if you all have read that. And it's so neat. So I was laughing one day and I said, I guess I'm the story collector. So because I have a tendency to draw women who experience loss, I just got a text tonight about someone that's still dealing with grief over a loss of a child, a baby from 7 years ago. So I'll be calling them tomorrow. And I do this all the time. I mean, this is a part of what I do even with church. But I collect stories and I want to know how they felt. I want to know their experience. I want to know the diagnosis. And so when I go into rooms, I share their stories in the way that they want me to share them. I don't try to, if they say the provider ignored me, I say, the provider ignored them. Does that make sense? I don't try to alter the story and alter the issue that is linked to something related to health disparities. So even though we're both African-American women, I could alter their story because that wasn't my experience. I had a phenomenal healthcare team. I didn't have the same experience that my other friends had. And their babies are living and mine isn't. But I don't go in saying that my healthcare providers are horrible because they were fantastic. They literally saved my life. They knew exactly what was going on while people around the country are being misdiagnosed for HELLP syndrome too often. So that's not my story. They were trained and they did a good job. However, there are many stories where that wasn't the case, and I share those. So connect with people that have that story, extend the invitation to the table. And if they're not ready to come to the table yet, be sure to be prepared to share their story in the way that they would want you to share it.
Yeah, I agree with Kim on all of that because as for me, I have to share stories of I've shared over 100 stories about PPCM alone and with how, the best way, because I'm actually having trouble with trying to get more of the patients to be able to advocate for themselves and to be able to raise awareness because the simple fact is we all was diagnosed with PPCM, but once we was diagnosed, we never heard of it before. And that's a problem because if we're able to be diagnosed, that means, okay, somebody somewhere knows that it's a condition that exists and why we don't know about it as a patient ourselves or why we don't know if we can be at risk if something that causes a pregnancy heart condition. Like who does, don't nobody know that. Like you could get a heart condition just because you're pregnant and even though you didn't have a prior heart condition, it could affect you anyway, and we don't know that. And so I try to stress it too, because we have a PPCM group. I try to, I don't like to force people into advocacy. Like I said, the hospital thought it would be best. And I too had a great team, as my sister didn't get to live and I did. And I really dealt with that guilt for a while. And I still have trouble dealing with it because I didn't understand why they was able to save me and not her. And then why the medication worked with me and not her. So, and I was, 7 years younger than what she was. But I trying to be able to advocate as much as I can. And with me being able to share the stories is actually helping more of the African-American women to be able to bring out their stories because a lot of them like to be on the quiet side and not really discuss it and talk about it because we don't know how important it is. We feel like, oh, it's just us and no one, we don't get the support that we need, and when we do try to advocate, now we having confrontation issues, with each other, who's spreading the most awareness, and that's a problem because if we're all doing the same thing, we're supposed to be able to connect and be able to do what we're doing now, you know. But in some people's eyes, everybody has their different missions on what they're doing, which is good. Everybody can have a different mission, but at the same time, it's for the same thing, and it all adds up to the maternal mortality, which is we're finding out slowly that more and more women in pregnancy are dealing with heart conditions. So I agree with everything that you know everyone just said, and then with Kim and with that being able to reach out and to tell people stories, you know, because I do catch myself doing that, you know. If it like when the scientific meeting I had a few weeks ago, I was asked some question, and it didn't pertain to my story personally, but I was able to speak out on something else that I had to write out, because I write all these stories. So I'm the one that's reading them, and I can relate to each one of them because I have that same condition. And on top of that, I know how to bring it out or bring the attention of a specific thing. Okay, if a doctor didn't have this attention on this patient, or if they didn't get listened to with this patient, okay, my situation was similar, but at the same time, my you know, heart didn't stop. We have some patients that heart actually stopped, you know, after being sent home. And with me, I went through hemorrhaging. And so with the hemorrhaging, I, you know, they still didn't know my heart was, you know, malfunctioning. But like I said, the more I read the stories, and it brings me more knowledge onto, okay, well, now we know that if a woman has a stroke or a heart attack, that's a link to PPCM off the top, you know, and a lot of women aren't going to know that. And if they don't know that, we're not researching to find out, or we're just being told that this is natural cause and sometimes it happens, but at the end of the day, it's a condition for it, and people need to know that. So yeah, I agree with everybody.
All right, thank you, all of you, for such honest and open answers. I appreciate, and I've appreciated all my discussions I've had with everyone here. I know we've all talked and spoken before this as well. So one of the questions that's come in is asking Brianna to explain how you've reached out to the media with success. How have you reached out to them?
Oh, well, like I discussed earlier with the I have to start with the cardiac rehab. Cardiac rehab was a major step in it, because they actually felt the need bringing the news, news station, to be able to try to advocate for themselves as well on this story. And so when I seen how the hospital wanted to be involved, I was like, okay, well, maybe it's something that I could take and run with it, you know, because once you kind of get thrown out there like that, you don't want it to stop. You kind of want it to keep going, so other people can more so they go from the first thing that they see your name in. So with my situation, that's kind of what happened with me. So everybody's seeing this news article, oh my gosh, she got a pregnant condition, you know, and I didn't want to let it to stop there. So in my thoughts, I was like, okay, well, before I did the blog, I was like, I want to do a short film after I had gotten these PPCM groups, and I saw that I wasn't the only one, or my sister wasn't the only one, or it was, you know, thousands of us. And so I was like, well, why are we up in this group isolated? Like, can't nobody, we telling each other stories, but it ain't helping us. You know, it's not saving a life. It ain't doing anything. We're just talking amongst each other, giving people triggers, and that's about it. So I just thought that, okay, well, what if we start like a little commercial or start a little film or something? And that's kind of what I went with. So I started with the local PPCM patients who was locally to me. And thankfully, I was able to find some. And we was able to do our first little short film. It didn't really reach a lot of people like we wanted it to. But at the same time, people don't know what PPCM is, so they're not going to focus on it. And with that, I was like, okay, well, I knew I had to keep going with something. So I wanted to do the blog. And so I kind of just started reaching out into the group and asking, you know, will anyone who's not easily triggered be able to share their story, you know, because it would be very important for us to be able to, you know, try to reach out into the public. Hey, baby. To reach out into the public. And so I wanted to be able to find a way through the media to be able to do that. And I felt like, sorry, my daughter is like bothering me, but I was wanted to share their stories, and by me being able to do that, I could bring more awareness to the condition, because in each story I add that, okay, she was diagnosed with PPCM, and then I go into the whole definition, or our definition on what we think PPCM, or the unrecognizable condition, instead of calling it rare. I had recently was told by another heart sister that maybe we should stop calling it rare, you know, and maybe that'll probably help a lot if we, you know, just say it's unrecognizable, which in the public eye, because if people look at it as rare, then yeah, they're gonna take it as, oh, okay, that's not gonna happen to me. And that's the same thing I did. Like, I felt like just because my sister had a heart condition, I'm not gonna get a heart condition. And that's exactly what how I felt. Like, once I had brought up with my OBGYN that I had a heart murmur, she was like, oh, it's normal. People develop murmurs all the time. You know, it's gonna go away. And I was like, okay. So I was like, okay, then I ain't got nothing to worry about. And so all of a sudden I get to the hemorrhage. I'm like, okay, why did I know I was at risk for hemorrhaging? I didn't do this the first time. You know, I didn't even know my blood count was low. I didn't know any of that. I didn't know the signs for hemorrhaging. And but I kind of skipped the hemorrhaging part because it was awareness out for hemorrhaging. I mean, it was awareness out for hemorrhaging, but it wasn't at that time for me to be able to know I was hemorrhaging. And so once I found out about the heart condition, and we was kind of thinking with the cardiologist was trying to link the hemorrhaging probably was due to my heart not functioning properly at the time of labor. But of course, no one knew that. You know, I had the signs of a heart condition, but you know, with the advocacy being as low as it is for the PPCM, everybody was kind of shocked when they found out that my heart was failing. And so with the sharing the stories publicly, I just feel like Facebook and Instagram and, you know, Twitter, it done came a long way when it comes to stuff like this. And you're able to boost your posts, or you're able to be able to send a message that you're trying to send out. And me, I like films. I like to do film makings and stuff like that. So I'm like very big when it comes to trying to advocate. I was like that anyway. I didn't know that it was gonna end up being handy for something else more important. So, because I did classes in high school and stuff about films and doing things, but I just used playing around. But I didn't think I would need it for anything serious. So now I can see, you know, use your talents to be able to save other people. So I was like, why not do it in the media? You know, and I'm slowly getting more and more women to share their experiences. I'm getting more than what I started with, I know. So I'm probably about at 150 stories, and I have some that's just kind of saved because it's just me doing it. So sometimes I might get tired, or I'm still working my physical job, so I have to take my frequent breaks. And then, you know, I have to make sure I'm not being triggered as well, because I also have to have my own emotions, because may have think about something, you know, traumatic, what I went through, and then my sister being gone and her kids still here, and, you know, looking at my kids and trying to make sure I'm still here, and being able to try to talk about these other stories. So it's a roller coaster, but, you know, I'm slowly developing it and getting through it the best I can. I think I answered that right. Did I answer that
There's a
right?
lot. Been a lot of great things that you've been like saying too. That's brought a lot to mind of things. You know, we all I think deal with is like the triggers and the burnout and the, you know, you have to kind of, this work is hard, and you have to take care of yourself while you're doing it sometimes, and to take a step back and to make sure. And okay, does a fantastic job of talking about that as well. We have some time. We have a little bit of time left. So if anybody has any questions, if you want to unmute yourself, if you want to ask, I see Eleni's on the line. She always has questions. So
I appreciate that, Nicole. I didn't come. Well, I didn't come with questions as much as just wanting to come and listen and learn from these awesome women. So if I've learned nothing else over the, you know, many years, it's to treat this issue with extreme humility and to be a listener and a learner. So thank you all. I'm here to listen and learn.
Excellent. Anybody else? We have a few minutes left. All right. Well, I thank you all so much for joining us tonight. And I thank you not just for tonight, but all of the time that you've opened up to speak with me and to answer some of my dumb questions. But to opening honestly and know like it's coming from a place of sincerity and wanting to learn and to listen and to be able to be the best representation for all maternal health, and then also to make sure that representing the issues correctly. So I thank you for all of your time and your friendships along the way. It's been great getting to know everybody. And I know we look forward to working together some more. So I think this discussion, you know, there might be more that we have in the future for sure. This kind of topic thing where we have a little panel and be able to ask some questions and just talk through some things was great. So thank you for your time. I really appreciate it.
You're welcome.
Yes, thank you.
Thanks, Nicole.
A lot.
There are no dumb questions.
Thank you.
There are no dumb questions.
Oh, I ask some dumb questions sometimes. It's okay.
Yeah, no question is dumb. Yeah.
Thank you for sharing your
But thank
perspective.
you. Thank you. Thanks, everybody. It was
Thanks.
Thank
Thank you.
Night.
nice. Belated birthday, Kay.
Thank you.
I know. I hope she celebrated well.
All right, y'all. Have a good night.
All
Thanks.
right, y'all too.